I try to think of the more sinister perspective, like why would they be pushing this? Because the money doesn't make sense to me, and it might sound like a lot of money, but in the grand scheme of things, it's not. It was the annual savings is projected to be, and this is a huge swing, so I don't know who's doing their numbers, but between 34 and $136.8 million a year. That's not a lot for a country.
So 2021, they saved $86.9 million.
Okay.
On not providing by doing.
But that's
MAID.
not a lot.
But if you do that, but think about this: if you do that at the small number they're doing it before a full expansion rollout, then you factor in the amount that it's going to take to put somebody in proper care for mental health. So say you get a 14-year-old who's depressed, maybe they are bipolar. Okay, well, let's think about the follow-up care, the amount of time on doctors. Canada is already so short, it's death care. You cannot get into a doctor unless you go into the emergency and then you're there for a day. People are dying in the waiting rooms constantly. So think about, it's not just the financial number. Think about everything else that goes with it. Take veterans for an example, because this is where I can speak to a little more from an educated perspective. GWAT happened. So Afghanistan, Iraq, finished. Well, we had X amount of people that go. We had X amount of people come back with post-traumatic stress disorder, some form of mental illness, or cancers from burn pits and exposure. You name it. People who lost limbs, amputees who need new limbs on an ongoing basis. And then you've got their pensions. Then you've got their pay. So when you add up the amount of money that is actually saved from one person who's maybe a burden on the system. This is not just a financial medical play for savings. It's the actual individual and what that person costs the government on an ongoing basis. And our veterans, most of the time, we were looking at 18 to 27-year-olds. Okay, so you have to look after them until you're 75. That's expensive, and that is huge on the system. And then you turn around and we're giving crazy amounts of money to Ukraine. So Canada can't sustain that the same way America can't. So the best way to do is remove the burdens from the system, just like they did in World War II, the people that needed a little extra help and all of this out of compassion. Then you're freeing up crazy amounts of capital. So the number may not seem big, but when you break it down, it is quite large.
And it also seems like such a paradox that the country that's doing the most innovative work with psychedelics for specifically PTSD is also pushing something like this. I think it was maybe on the trigonometry episode, or maybe I watched Vox too, and they did a debate between someone that worked at MAID versus a psychologist that was very, very hesitant about it. And I think they were talking about, I think it was also a veteran that came in, and it was the first thing that they offered. Yeah. And to her, she's like, well, it's not a good option. It's tricky. It's really tricky if you're on a wait list. And that if you can just wait long enough, if you can, outlast the clock, this thing on the other end will help you. Right. But that waiting period, she had no problem with them using MAID while they were on a wait list. And she's like, well, it's tricky.
It's not tricky.
It's not tricky. How's that sound of mind? And I don't know, it just seems wildly unethical and kind of like malpractice.
In my personal opinion, it is. And what's going to end up happening is the same thing that's going to happen, and you're about to see what's going to happen with all of the detransition and all of the doctors. There's going to be lawsuits like you've never seen coming.
I was watching someone talk about that, and they didn't think that the lawsuits are going to end up happening because you have all the institutions as that is the proper protocol.
Oh, so care.
There is no misalignment between what the doctors are doing at these clinics versus what the institutions of pediatrics are suggesting. So if there was a discrepancy there, then technically the doctor was acting out of line, but because the institutions are captured, that no one's going to be able to actually sue. Maybe your parent, maybe you'll be able to sue your parent.
You could.
I'm not sure.
There's got to be a line there for some sort of consequence, because realistically, the long-term damage is obvious, and we're seeing it with more and more individuals coming out and speaking about it. The same with MAID. You can't just kill people while their families don't know and give them an opportunity.
Well, I'm so torn. I'm really torn.